Hi, everybody. I am Jessica Shore. I am the Director of Clinical Affairs and Advocacy here at CurePSP. I am so glad to be with you today to moderate our Ask the Expert webinar on the very important and very exciting topic of CurePSP's growing legislative advocacy efforts. A new way for our community to be able to participate in advocacy and define what that means for your journeys with PSP, CBD, and MSA. We have a lot going on in this space right now that we want to be able to update you on. But before I pass this to our experts to really delve into it, I need to briefly go over a few housekeeping items. This program will be about an hour long, including the different presentations and a question and answer discussion session. We are recording this webinar live, but it will be archived on our YouTube channel for anyone to be able to view later. You're welcome to type questions into the chat section of the platform that you're using to view this on. We'll also be referring to the questions that many folks submitted when they registered for this webinar. If we don't get to your question for some reason, please shoot us an email at info@curepsp.org, and we will do our best to get you the right answers and resources from there. Also, if you're watching this live, we always really enjoy when you use the comment box to say hi and let us know where you're tuning in from today. We have three fantastic speakers with us. First, you're going to hear from Julie Balasalle. Many of you are already familiar with Julie, as she has been a passionate volunteer with CurePSP for a few years now, continuing her mother's legacy and combining her professional experience and her lived experience as part of our community to guide our advocacy initiatives. We also have Nisha Kwaspa from the DC-based consulting firm that we recently hired called Fake Great Drinker, which you'll learn a little bit more about, who we've been working closely with over these past couple of months. She's been advising us on the formation of our public policy and legislative agenda and helping us to build relationships on the Hill. And then last, but certainly not least, and we're so thrilled to have her as a guest speaker today, we have Elizabeth Cooper. She's joining us from the office of Representative Subramaniam of Virginia. He has been proving to be a real champion for people with neurodegenerative diseases, really following in the footsteps of Representative Jennifer Wexton, who many of you know. She was diagnosed with progressive supranuclear palsy a few years back and worked closely with CurePSP over these past couple of years. CurePSP is really fortunate to have all three of these experts as partners with us as we continue to build our advocacy arm of our organization and create new opportunities for our community to be engaged at this highest level of awareness and action. Thank you all for being with us today. And without further ado, I'm going to pass it to Julie and we're going to get started.
Hi, everybody. It's wonderful to see you all. Love seeing all of the shout outs in the chat. Hi, Al. Hi, Amy. And Don and Brenda. Good to see you all. So as Jessica said, my name is Julie Balasalle. I am a social worker by training, and I'm a community organizer by trade. Those are sort of both of the same thing. But I am here because my mother received a probable diagnosis of cortical basal degeneration. And I had no idea what that meant. So I reached out to Jessica from CurePSP to learn a little bit more about the advocacy work that CurePSP was engaged in. And so really started to work with Jessica to think about what that could look like. And this was back in 2022. So my mother passed away with the probable diagnosis of cortical basal degeneration in January of 2023. So 10 months after her diagnosis or probable diagnosis. So I do this work for her. And in my professional job, I work for an organization called IMALS. And so I sort of wear the neurodegenerative hat, advocacy hat in both my roles. So I'm really happy to be here with you all today. and really excited to give you a little sense of where we've been, where we are, and where we're going. So in 2022, we sort of, like I said, I reached out to Jessica, was inquiring about advocacy, legislative advocacy in particular, and in the beginning sort of conversations about what that could look like for CurePSP, the National Plan to End Parkinson's Act was filed for the first time in Congress. And we sort of hit the ground running in trying to mobilize the community. It was the first time that our diseases were mentioned in significant legislation. So we really wanted to try and mobilize as much as we could to get people engaged and create tools for them to advocate through meetings with members of Congress, through letters, all of that. So it was really sort of the beginning stages, and we were kind of gratefully thrown into it for having that opportunity to advocate for that piece of legislation. It did not pass that first go around, which is very common for legislation, and it was refiled in the next session. And so we really focused more on organizing our community. And what that looked like was helping people feel comfortable meeting with their legislators, training them on what to expect in legislative meetings, and really trying to build relationships with legislative offices, as well as creating some new tools and awareness opportunities for our community to engage in the way that made the most sense for them, no matter where they were in the country. So that was really part of a lot of our work, and working with our partners and the United Parkinson's Advocacy Coalition, as well as our community leaders as well, and our support groups and all of that. So that was really a big year for gaining momentum. And we also really started to form our relationship and with Congresswoman Jennifer Wexton, who I don't think I really need to give a ton of introduction to. She was a huge part of the refiled piece of legislation that was passed in 2024. And she really did an incredible job of prioritizing raising awareness within Congress for PSP, CBD, and MSA that we are eternally grateful for. And through her leadership, we were really able to, like I said, have opportunities to do things that CurePSP had never been able to do before, such as host a congressional briefing for the first time with Representative Wexton and other champions of PSP. And we also were really involved in the first filing of the Healthy Brains Act as well. And that was through her leadership. So through her, sort of steadfast passion for raising awareness for these diseases, we were really able to have a platform that we hadn't really had before. So a lot of the work that we do is because of the foundation that she was able to lay for us. And to continue and sort of build on that with the national plan passing in 2024, which was incredible, passing into law. And in 2025, what we've really tried to do is start to really look internally at CurePSP about how we can sort of build our advocacy arm in a more sustainable and applicable way. And so we formed our first advocacy steering committee, which is a huge undertaking. And I think also just want to say that we have people who have all different connections to these diseases, as well as from all over the country. So we really wanted to try and have as much of a rich experience or have people who have rich experiences with our diseases be able to help us sort of figure out where our priorities should be. And so it's really our sort of laying that first brick in understanding what CurePSP, where we're going with our advocacy. So we have a sort of a subcommittee structure. So we have our main committee, and then we've sort of broken down into smaller subcommittees where a lot of the focus is really parsed through a little bit more finally. So we have a legislative agenda subcommittee that's looking at a variety of different bills to sort of see which bills we should prioritize, which ones we shouldn't, where should we sort of rank them, what resources should we put on to specific bills. We also have a committee that's working on resource development. So some of you have heard some fantastic work that's going on the state level around resolutions that are happening in different states. And so we want to try and create some resources for people to replicate that work in their own states. And so that's one of the first big projects for our resource development committee. Our appropriations subcommittee is really focused on the appropriations process that happens in Congress. And so making sure, we have a sense of where that process is, what we should be asking for appropriations, where we should be spending our time and energy, and how to advocate for that. So that's an extremely important process that happens hopefully every year in Congress. And our last subcommittee is really focused on, and this is sort of our foundational committee, is like, what's our mission statement for our advocacy steering committee? What are the things that we want to work on? What are the things that lie outside our scope, to make sure that we are able to give a really strong sense of what we're doing. And so that's sort of our structure for the steering committee. And also just want to say that we are really working on communicating all of this to our community. Some of this stuff moves kind of fast, and so sometimes we aren't able to get everything out to everyone right away, but that's part of what we're trying to figure out, and how to be more efficient in that way. So really appreciate everyone who is interested in this kind of work and wants to know what we're doing. I cannot thank you enough. And so we, as soon as we are sort of in a more sort of on stable ground with our committee, we'll be able to have a lot more communication with the community on regular sort of update basis. And so one of the things that we get asked, or I get asked all the time anyway, is sort of what's next for the National Plan to End Parkinson's Act. And, since it passed into law, so like what happens now? So we're in the implementation phase of this piece of legislation. So it's actually now known as the National Plan to End Parkinson's Project. And it has, in the legislation, is under the Department of Health and Human Services. And that has also been relegated now to the National Institutes of Health under HHS. And so they are the ones who have been charged with creating the advisory council. They opened nominations for participants in January 2025, and then those closed in February. We haven't heard anything since then. And so we are, sort of waiting along with everybody else, but we are closely monitoring this in the Federal Register and all of the publications to sort of see if there's been any movement, and we will let everybody know as soon as we know something as well. But just wanted to give that note in terms of what's next for that. And in looking through sort of the what we're looking through in 2025, Nisha's going to talk about our appropriations process and sort of what that has looked like. But basically, we've been able to have some really wonderful meetings with congressional offices to talk about our appropriations asks, which Nisha will go into. But really, again, our big focus is one of the things is really trying to educate members of Congress about our diseases, to build on that foundation that Representative Wexton laid for us in terms of sort of, like I said, raising awareness, but also increasing competency and understanding of our diseases. And so again, sort of that has been a huge focus of what we've been working on. We're also sort of, again, thinking about where should we put our energy. There's a million things happening at any one given time, and making sure that we're monitoring all of the developments and changes in a rapidly changing landscape on the federal level. So making sure that we are staying up to date on what's happened with federal funding and making that a huge priority for the organization. We've also really tried to parse through a lot of what has happened in this current administration, but also making sure that we are reiterating to people the importance, not just to members of Congress, but to our own community, the importance of research funding and what that means to our community in particular. And then lastly, we are, like I said earlier, one of our subcommittees is working on our legislative agenda, which is a list of pieces of legislation that our community, that we are going to ask our community to really try and champion and mobilize our community around. So that's sort of where we are right now in terms of our priorities for, not legislative priorities, but just sort of our advocacy priorities in general for 2025. And so you may be asking, like, how can I get involved? What do I need to do? How can I help? Well, we definitely need all hands on deck. There's a lot of moving pieces to a lot of this work. We're, like I said, going to be having more regular updates in the newsletter and on social media about the work of the committee, but also our actions that we're going to ask our community to take, which Jessica has done a fabulous job of prioritizing for the organization. And then sort of being more present, we'll try and have some more opportunities for community engagement with our steering committee and opportunities to sort of just, again, sort of maybe become more of that sort of those resource development pieces that we're making for different states to get involved. So we're really trying to think about ways that people can be engaged in a way that works for them. So that's sort of where I would really love to sort of connect with people about sort of how you want to be involved, what you want to be involved with. We are a small but mighty team. And so really want to make sure that we are paying attention to the pieces that matter to our community. So with that, I mentioned Nisha a few times, but Nisha is going to be taking on the next, that's my favorite little, I always show this in almost every single presentation I ever do, but just the importance of mobilization of our community, what we can do with it, the importance of sharing resources with each other, being on the same page, and we can really make a difference when we're focused on organizing our community. So that's a big piece of what I'm working on with our committee. So with that, I will turn it over to Nisha.
Hi, everyone. Hopefully you can all hear me. Thank you for having me, first of all, and thank you for that overview. So I'll talk a little bit about our engagement with CurePSP and then get a little bit deeper on appropriations and what are we working on for the rest of the year. And so next slide. So CurePSP, and I think you heard quite a bit, has been actively exploring ways to grow its advocacy footprint in DC, engage more with Hill offices. And the organization is aiming to elevate its voice in federal policy discussions, while also empowering the community, which you just heard, about organizing patients, caregivers, researchers to really be swimming kind of in the same direction. And so with that focus in mind, Faegre, so Faegre Drinker is where I work. It's a law firm, but we also have a government affairs arm where we basically guide a lot of those who work in the healthcare space, so patient advocacy groups, providers, and the like, to understand the DC sphere and how to actually prioritize your policy priorities and how to navigate Washington, DC. How do you translate policy to action? Is it politically feasible? What's the priority? And so that's the type of exercise we've been working with CurePSP since engaging in April, and we're only in June. And so you'll hear a little bit as far as what we've started to work on. When we launched in April, our primary focus was to get on board in the appropriation cycle. A little bit about the appropriation cycle. It starts, FY26 starts on October 1st and goes to the following year, so 2026 all the way to 2025, into 2026. And so to get any type of asks in the appropriations bill, the process actually starts now. So in April and in May and even the months prior to that. And so when we entered, we were like, okay, well, what are we going to talk about? And we'll talk about appropriations in a bit, what we actually submitted, who we submitted to, what our strategy was. But that was our first task on our list. After that, which is kind of the process we're in now, is understanding, okay, well, we did appropriations, but what is going to be CurePSP's policy principles, priorities, and then what are the actual steps for each of those buckets? And we'll talk through what that actually looks like. What this really means for all of you is kind of those last two bullets that are on the slide. What you can expect from us is that you'll have hopefully more opportunity to engage with the Hill through meetings, through action alerts, and other advocacy efforts, whether it be through briefings, press conferences, and whatnot. And we're also going to be having that policy priorities tracker where you can actively, we'll keep it, it's going to be a dynamic document. You can really see, okay, what are the bills that we're tracking? What's the status of those bills? And then where is it hitting on CurePSP's priority list? And I'll explain a little bit about how the sausage making is for creating that list. But I'll go to the next slide to just level set as far as what is happening in Washington, D.C., kind of lifting the hood or whatever the metaphor folks talk, anything but inside the baseball. So next slide. So we are now 136 days into the new administration and Congress. So just about 4.5 months in, and the pace of change has been striking. And I'm sure you all are probably keeping up with the headlines as much as we are. And what we've seen so far from the start is a strong hand of the executive branch doing a lot of top-down approach, particularly in influencing economic policy and legislative activity. The result has really been a remarkable level of change, both in tone and action, which has certainly created a sense of uncertainty, but also opportunity for change and reform to some extent. Next slide. Since January 20, since President Trump was inaugurated into the White House, there was no waste of time. There was tons of executive orders that came out in a fury. A lot of them caused concern, especially in the healthcare space, with a lot of cuts. And some of them are listed, and I can talk about some of them. One is in February, there was the NIH issued a new guidance establishing a 15% cut on indirect cost rates. Indirect costs are expenses not directly tied to running a clinical trial or research project, but such as the infrastructure to actually run a trial, which are really, really important. So we're talking about recruitment, office space, utilities, administrative staff salaries. And this decision rate of cutting it to 15% raised significant concerns across academia, as many feared it would impact the resources needed to actually support the infrastructure and to actually keep the clinical trials going. Another big piece was in February, there was an executive order to reduce federal workforce. And what we saw after that executive order, HHS announced a major transformation just a month later, laying off about 10,000 employees. Combined with earlier rounds of cuts and voluntary departures, this marked about a 25% reduction in the department's workforce. And the last item I'll talk about in executive orders are in the healthcare space, or several in the healthcare space, including drug pricing executive orders, was also the launch of the Administration for a Healthy America. So AHA for short, essentially consolidates 5 agencies into one, including HRSA, which is really important for newborn screening, some other implementation of a lot of policies, and SAMHSA, so substance use, all being under one, with a lot of focus on chronic care, disease, and prevention. So beyond executive orders, and sorry, I just want to go right back to the yes. But the administration is not, just focused on executive orders. It's done a lot of other things. The one that I really want to emphasize, which is the second main bullet, is streamlining federal government with the stated goal of accelerating efficiency and reducing redundancy. That has unfortunately caused a lot of downstream consequence, where we're seeing a lot of grants and programs paused or terminated, particularly those that are seen as misaligned with the administration's priorities, and a lot of effort to shrink government, which effectively disproportionately impacts the healthcare sector, which represents a significant amount of the federal budget. And so it's often happens to be a target of cross-cutting measures and reform. Next slide. So I'm not going to walk through each one of these, but just to put a finer point on this, there has been within the president's budget, which was released just a couple weeks ago, which is considered the skinny budget, includes significant cuts to NIH, some institutes being cut, also cuts to HRSA, which also got consolidated into AHA, reduction in workforce, and a number of other kind of downsizing of just government decentralization, a common theme that we're seeing throughout these first 4 months of President Trump in office. Next slide. What's probably most important to note is last week, there's something called the HHS Budget in Brief, which is a short summary of the Department of Health and Human Services annual budget requests. It essentially highlights key funding priorities, major programs, and how the department plans to use its resources. I did want to put a high note on probably that purple strip that's in the middle, where you see that NINS, the National Institute of Neurological Disorders and Stroke, is going to be consolidated with 2 other institutes into one called the National Institute on Neuroscience and Brain Research. And so we have dental cranial facial research, NINS, and then National Eye Institute being consolidated together. We can imagine that type of downsizing will certainly impact certain resource and programs within each of those. And that's something that we're definitely keeping a high note and monitoring as that kind of plays out. This is just step 1 or 2 before seeing implementation of any of these coming to fruition. Next slide. So reconciliation is another huge item that's been on the list for this administration. Reconciliation is effectively a fast-track process for budget-related legislation, specifically for spending cuts or tax changes. And so if anyone has been following the news, this is the time of the moment. Everyone's talking about reconciliation. What's really important is the amount of reform that they're doing to Medicaid specifically. To keep a really complicated conversation short, the administration wants to make significant cuts to improve the national deficit. And so to do so, a lot of impact was put on Medicaid. And so you'll see work requirements were included, limitations on how state does payments, and a number of other restrictions have started put on Medicaid. The reconciliation package was just scored, and it actually was passed by the House last week on partisan lines, and it would reduce federal spending on ACA marketplace coverage by $301 billion and Medicaid by $806 billion. So those are pretty big numbers that we're going to see. I know on the slide it says Medicaid reforms were not as severe as expected. I know some of you probably thinking that's not bad enough. There were certain other provisions that were thought to be included on Medicaid that ultimately did not make it. On the political side, the House passed it. It now goes to the Senate. The Senate, they're going through a lot of tension and I would say a fight for sure on what gets included. I think the major point being that the Senate has a deadline of getting it passed on July 4th, which is less than a month away, but having several members that are really concerned about some of the Medicaid provisions, and then some members thinking that the reconciliation package doesn't go far enough in spending savings. So definitely something that we'll be monitoring, because there's a lot that this is where all of Hill attention is at this moment, especially on the Senate side. The House just finished their job a week or so ago. So this is definitely taking a lot of time that you probably are seeing on the news. Next slide. All to say, I think a lot of attention now will be on the House. They have just frankly a bit more breathing room with reconciliation being behind them. Appropriations, there's a lot of hearings that are happening. Members already submitted to committee their requests, and you hear about that a little bit later. And the House is more likely to advance legislation. Just typically, they're a little bit more productive when it comes to getting legislation out of committee of jurisdiction. And so we'll continue to monitor what those bills are, and we'll talk about which bills we'll be monitoring in a bit. Next slide. So appropriations. I know we talked about this quite a bit. You heard it previously as well. And so when we got engaged with CurePSP, we thought, okay, well, what is the one thing we can get done in a short time period? And we put this next slide. We put this language together thinking, okay, what's called report language. report language gets included into appropriations bills. They don't hold the rule of law, but it certainly is a very strong indicator, if it does get included, to agencies that Congress has intent and has directed them to do something that they want them to do. And so I highlighted the main ask that we have. And the committee, so the Appropriations Committee, is telling NINS, specifically directs NINS, to ensure that PSP, CBD, and MSA included in relevant programmatic initiatives, data collection efforts, and strategic planning activities focus on neurodegenerative disorders. Specific attention should be given to the development of diagnostic biomarkers and therapeutic targets. These are certain types of pain points we discussed with CurePSP. Where would they want to see advancements? And this is how we kind of crafted this language. We ended up sending, just a little bit of the background, we ended up sending this language to a number of offices, bipartisan, bicameral, meaning both Republican and Democrat offices and those in the House and the Senate. With that said, we also met with committees of jurisdiction. So they're going to be the ones who actually get the requests from individual offices. And then what we did was like, okay, we sent the information. And the way we picked actually those targets is twofold. They're members who either supported or co-sponsored the National Plan to End Parkinson's Act, or they have a Virginia connection given Congresswoman Wexton's influence in the state, or sit on committee of jurisdiction, whether it be in the healthcare space and the appropriation space. And so that's how we got those 10 targets. And we had really productive conversations. We actually included some constituents in those meetings. So they got to actually hear from actual patients to make it even more, to put a lot more compelling what this request really means to the community at large. And so what the next step is for this is, go back just one. Yeah, so the next step for appropriations is for, okay, we did our groundwork. Now it's a matter of members actually submitting it. And so we gotten some indications, some have done that. And next is, once the actual FY26 language comes out, is for us to see, did our language actually get included? And the timing of that language will be quite some time from now, but we'll surely continue to monitor that. Next slide. So, okay, we did appropriations. Phase 2 of our engagement is now, we have 2025 ahead of us. What are we going to prioritize? I mean, there's a lot of issues that the community faces. How do we actually start thinking about, okay, we have limited resources. Where is our voice, CurePSP, the most influential and most impactful? So next slide. So I would want to orient first to the first three. So CurePSP, before Faegre got engaged, already had core policy principles. And those are the three that are listed at the top: cure, consciousness, and care. And under each of those, you kind of see even more detailed description of what policies we have under. But see the top three as like really high level bucket issues, with underneath those being additional targets. So for instance, appropriations hits that first bullet under cure, which is improve diagnostics to PSP, CBD, and MSA. Submitting that appropriations language effectively is like an action item that we did for that bullet, because that's one, not the only bullet, not the only action we could do, but certainly one action we saw as taking for, okay, how do we improve diagnostics to PSP, CBD, and MSA? Well, we'll do an appropriations play. For some of these other ones, what we have thought through is, okay, what we heard from several members is a whole host of issues, from DME issues, from coverage of certain types of services like social work services, misdiagnosis of a lot of the diseases. How do we fix that? Is there provider education? And so these are all other themes that we will make sure to include as action items for each of these bullets as we build that out. And I know this might be a little bit hard to conceptualize, but let's go to the next slide. So thinking through, okay, we have bills that are on the docket. Not everything needs to be a bill that actually moves the needle forward for some of our policy priorities. But some bills do exist already on the docket that we have either endorsed, which is the one in blue, which you'll hear so much more about from Elizabeth, from Representative Subramaniam's office. But then we also had some other ones, and you're going to see in that last column, which is the priority bucket, the cure, care, and care. And then what does that actually mean when you think about which bucket does that fit under? And certainly there's only 3 bills on this list at the moment, but this is just a glimpse of what you can imagine to see. And this will become a growing list. that's one piece. It will be a growing list with that priority bucket also being included. But third is that just because it's on the list, that does not mean CurePSP is going to be leading the charge. Some of these bills, especially the telehealth one, is actually really led by some other organizations. Same with the Credit for Caring Act. Credit for Caring Act is really led by AARP. Connect for Health and Telehealth Modernization Act is led by a lot of the telehealth organizations out there. So rather what we're going to do, and we're working through this with the subcommittee that Julie mentioned, is understanding, okay, where are we going to lead? And lead will be, if CurePSP doesn't talk or say anything, it will never happen. And that was our appropriations ask. I don't think we can imagine or rely on any other group to talk about PSP the way that we did, or CBD the way that we did, or MSA. So that was something that we were leading. Then one thing about engaging, things that are really top priority, but not necessarily the ones that CurePSP is leading the charge, but is high, we will be mobilizing the community. Other ones are, okay, let's support. We'll be supportive. If there's one-off sign-on letters, we'll sign on. So we're still engaged. We still have our voice there, but we're not leading the charge. And then lastly will be monitor, meaning, okay, we're keeping it on the docket, we're keeping an eye on it. And so we're just in that infancy of that sausage making of, okay, let's list out all the bills, let's list out all the policy levers, and then thinking through how do we prioritize those moving forward. So all to show you this, that this is just the beginning and you'll see an expansion over time. What we're really excited for is that we've already endorsed one bill this go around, and that's the Healthy Brains Act, which I'm really excited to introduce you to Elizabeth from Representative Subramanian's office, who'll talk a little bit about what she does day to day as a Hill staffer, but all the work that her office is thinking through for this bill and strategy moving forward. So on to you, Elizabeth.
Thank you all so much for being here, and everyone at CurePSP for being such advocates for neurodegenerative disorders. Before we go on to talk about more of the legislative priorities, I just wanted to kind of give you a little background about me and why I'm here, why I'm interested in working in these issues. So I originally started working on Capitol Hill for Senator Tammy Baldwin, which if you know anything about the Hill, you probably know she's also a champion for healthcare policy. And my mother was diagnosed with Parkinson's disease more than a decade ago. So this was something that was very personal to me before I started even working on the Hill. And as is not uncommon for PSP patients, Congresswoman Wexton was diagnosed with Parkinson's disease before she was actually diagnosed with PSP. And when she was diagnosed with Parkinson's, I heard about it, and I knew that this was a very personal topic to me and wanted to work for her. And so I moved over to the House side into her office and got to help her pass the National Plan to End Parkinson's Act and to introduce Healthy Brains for the first time. So this is a very personal issue to me. I'm excited to be working on it. And then I also wanted to give you just a quick introduction to my current boss, Congressman Suhas Subramanian. He is coming from a tech background, actually, which is really cool. Not super typical of Congress people. He worked for the second Obama administration as a tech advisor and has worked at a couple tech startups. And so he's just bringing some really new, fresh ideas. As you can see, he's probably a little bit younger than people you're used to seeing represent you in Congress. And I think it's just amazing to work for someone like that who's bringing these new ideas and wants to shake things up a little bit and wants to be fast-paced. So working for him has been incredibly rewarding, and I'm so happy to tell you about how he's also following in Jennifer Wexton's footsteps with neurodegenerative diseases. So with that, if you could go to the next slide, that would be perfect. Okay, so some of his legislative priorities for this Congress are going to be preserving innovation in the American scientific community. I know we kind of touched on this earlier, but it's a very, there's a lot of turmoil going on with funding and the medical research space. And so he wants to make sure that medical research is well funded and, America continues to be the place to do medical research. One of his other priorities is ensuring that healthcare is accessible and affordable to everyone. This is also, something that we're battling with every day, it seems like, with the Republican Congress and this administration. But touching on some more specifics, specific bills that he wants to work on. So the National Plan to End Parkinson's Act is something that we're constantly monitoring to ensure is enacted. And I just wanted to show you something really quick in our office. We actually have hung up an official copy of the National Parkinson's Plan, and that is something we look at every single day. So just because it passed last Congress doesn't mean we're not still involved in it and not still trying to make sure that this is enacted and does, the best work that it can for folks so that we can get closer to finding a cure for Parkinson's disease. And then one of the other things he's been working on this Congress is he reintroduced the PSP Awareness Month resolution, and this designated May 2025 as National PSP Awareness Month. This is House Resolution 456, if you want to Google it to check its status. But right now there are 32 bipartisan co-sponsors. So he's really trying to forward Jennifer Wexton's legacy with that one there, and really just trying to bring awareness to PSP to folks on the Hill. I can tell you, someone that's worked up here and just went through this most recent creation cycle, other neurodegenerative diseases like ALS do tend to get, more attention, more research funding. So we're just trying to make sure that PSP is up there and that people actually know about it, because I think a lot of Congress people did not know that this was a disease that was out there until Congresswoman Wexton was diagnosed and they saw a colleague struggle with it. So that's something that we've worked on this year. And then something that I'm going to talk a little bit more in depth about is the Healthy Brains Act. And so if you want to, switch to the next, it's perfect. Okay, so the long title for the Healthy Brains Act is Harmonizing Environmental Analysis and Launching Therapeutic Hubs to Yield Bolstered Research and Innovation in Neurological Science. So you can see why we shortened the title to Healthy Brains. And the goal of this bill is really to make centers or hubs for research for neurodegenerative diseases and to study the environmental risk factors that may be causing these diseases. So right now at the federal level, research for diseases like Alzheimer's, Parkinson's, ALS, MS can kind of be scattered around. And we know that neurodegenerative diseases and their risk factors are connected, and sometimes their treatments can be connected as well. So we want to make sure, we think that these hubs can be a really great place to have people communicate and have a really consolidated plan for finding treatments and cures for these diseases. So this would direct the NIH to make these hubs for neurological science and studying those environmental risk factors. Just a little background on this bill. Jennifer Wexton originally introduced this bill. We are planning on reintroducing it soon. Our co-lead is Mr. Gus Bilirakis, who is also the co-lead for the national plan. And we have 5 original co-sponsors so far, hoping to get a lot more. Something that's interesting about this Congress specifically that wasn't present in the last one is that this administration is acutely interested in toxic exposures. If you read the MAHA report that came out a little while ago, they have a whole section on, it's like the accumulation of chemical exposures. And they list toxic exposures as something that causes disease. And RFK Jr. has specifically mentioned concerns about pesticides with chronic disease. So we think there is an interest there at the administration level and then on the Republican side that may not have been there previously. So we're hoping to gather as much bipartisan support and momentum from our Republican colleagues and from the administration to kind of avoid possible legislative roadblocks that would keep this from passing. And so kind of next steps for us is we are gathering those original co-sponsors and talking with the Energy and Commerce Committee to see if they have any concerns. And we're hoping to introduce possibly at the end of June, but I will keep CurePSP very updated on when that is going to drop. I know it was mentioned that CurePSP got to do a press conference with Congresswoman Wexton last Congress, and we're planning on doing that again. Again, just to really shore up support and make this, the introduction of this bill, as big as possible so that people in the administration who do care about environmental exposures and environmental risk factors to chronic disease take notice and want to pass this bill. That's eventually our goal. And if you could move on to the next slide, that'd be perfect. So I know that we already touched on appropriations a little bit, but I just wanted to give you another quick kind of insider behind the scenes look at that. So when we got this language from CurePSP, like I mentioned before, the congressman is really interested in making sure that Jennifer Wexton's legacy moves forward. So this was one of our top requests to the Appropriations Committee that we submitted this year. And unfortunately, we won't really know if it's included in drafts of the appropriation bills until probably late July. They have a markup scheduled for late July for the Labor, Health, and Human Services Subcommittee. So hopefully by then we'll see if it got included. I will let you guys know immediately if I'm able to find out any sooner than that if it was included. But we're really hoping that because the congressman really prioritized it and really had it at the top of his list, that it will be included. Otherwise, just want to give you guys a shout out again for being such good advocates, and we're happy to answer any questions. And I think I'll bounce it back to everyone at CurePSP.
Welcome back, everyone. Maybe we could take the slides off. There we go. Perfect. So we can see all of our Brady Bunch faces here. Thank you all so much. That was you covered a lot in a very short amount of time. And it's all just really important, really exciting things about, where we've been and what we're building on top of and opportunities from here. First of all, I have to say, because it's going to bug me if I don't, there was a major typo. It's Gus Bilirakis, not good Bilirakis. I had to combine 3 sets of slides into one this morning, everyone. So I'm so sorry that slipped through the crack. But anyway, I'm only human, right? So I'd love to open it up for just discussion and questions at this point. We got a couple of things in the chat. I have a few that we had received during registration. I think the one that's coming up time and time again, we're getting this on almost a daily basis at this point, but it was in the registration. Someone asked in the chat just now and that this could really be open to anyone or all of you who might want to speak to it. Can you talk about how the recent and also ongoing efforts to reduce and halt the funding and infrastructure for scientific research has been or could impact the current or the future research related to our community? So PSP, CBD, and MSA, and other neurodegenerative diseases. Like what is all of that's happening at the federal level with research funding mean for us? Nisha, I could start with you.
It's not great. I'll keep it simple at that, right? I mean, having reduction in some of these really important issue areas it's not going to have a great outcome. I do see consolidation and restructuring of the agencies, meaning streamline, which is also just a different way of saying like significant reduction. I do think that their advocacy is going to be much more important, and not overt advocacy, meaning like doing statements, but having a lot of conversations behind closed doors with NIH and even HHS Secretary himself, his office staff. I think that is going to be the new advocacy play that might be more effective. Because I do think, I'll be really frank, from a lot of just like behind the door conversations you have with both sides of the aisle, a lot of staff understand the concerns. It's not super foreign to them. It's just there's a lot, whether there's political will to continue that is a totally different conversation. But do know that there are champions on the Hill. We aren't out of them. They do exist. They understand the importance. I mean, I know in rare disease type conversations, folks might not have the visibility to specific diseases, but the things that they do understand is a disease, and if there's no treatment, then there's no hope for so many families. And you can kind of superimpose a lot of other patient stories onto the same kind of template. So I do think that there will be a lot of change. There'll be a lot of fighting for resources between one group or the other. And a lot of, grants have been paused and terminated, ones that are seen as controversial in nature. So we have seen bits and drabs of that. But I do think some of that stuff is not super publicly available. So the more communication, if you're part of a trial, if you work with other groups, the more intel we share together, the better we will all be, because a lot of this information is not all publicly. There's no list, to be frank, about there is a list of all the grants that have been terminated at NIH, but it's a lot of self-reported information, which is great. So if you all are hearing that, please bubble that up to CurePSP. Those are the things that we need to hear about. And then we can translate that and make sure we're going and knocking on the right doors at the agencies and to Hill staff.
I was going to say, just to add to that really, really quickly, with some of these grant cancellations and moving things around, a lot of the times we don't know it's happening until someone calls up our office and says, hey, my grant got canceled. Hey, my clinical trial got canceled. So please, the more communicative you can be with us, the better.
That's a great point. Thank you both. Okay. Question for Julie. What are we doing to make sure that we're including the voice of our community in driving these priorities and in these conversations that we're having on the Hill? In the foundation that we've laid, but also where we go from here. Because I know that is of utmost importance to you, to me, to all of us.
Yeah. So I think we've done a few things to date, and then, sort of looking forward, I think there's lots of different ways that we can continue to do that. But one of the things we did last year was a survey. We just asked people, what are the most important things to you? And sort of above and beyond what a lot of people sort of pointed to was the importance of diagnostics. So that points directly to research, right? So for lots of reasons, research is important, but especially for diseases that don't have biomarkers, research is an integral part of finding new treatments, new therapeutic avenues. So we heard that sort of loud and clear. The other thing we heard really loud and clear was caregiving. So, people who have caregiving challenges, whether it's due to where they live or just how sort of all-encompassing these diseases are. So we sort of, really wanted to look at where should we put our energy? And so we heard from the community that way, and then continuing to make sure that we, sort of check, there's thousands of bills that are filed every session. It would be impossible for us, as sort of Nisha alluded to really be able to give every single one our attention. And so where should we really put our focus? And that really goes back to what we hear from the community. And so that's really one of the main pieces of our steering committee, is to make sure that we have a really good pulse on what's happening in our community. So, as Elizabeth and Nisha said, communicating to us or congressional offices, and both, I would argue, about your concerns is really important. And I think too, as an organization, we're really trying to think about how can we make sure that we're communicating all of the work that we're doing with our community. It's not always something that can happen right away. So what can we do to make sure that we're providing you timely updates? Because it's an uncertain time with a lot of different pieces that are moving really quickly. So we want to make sure that we're having conversations with our community like this, where we can let you know, what's going on, where we want to give our time and our focus, and more importantly, how you can get involved. So I think that's one of the biggest pieces that I'm really concerned about, is how can we really amplify our community's voices to their legislators and also other policymakers that need to hear about it, because there's a lot of noise right now. There's a lot of chaos. There's a lot of uncertainty. And I think one of the most important things to sort of remember is, like, we can't control the winds, but we can adjust our sails, right? So, like, what are the things that, this community is incredible in so many ways. And, these diseases are, like I said, all encompassing. And so part of what I really want to make sure we do as an organization is make sure that what you think is important is included in our priorities, and have a continual loop with our community to make sure that that's sort of front and center in all that we do, sort of balancing that with the realism of our climate right now. So I think that I can just sort of say that until the cows come home, but really it's trying to find ways that's sustainable to get that feedback from everyone in a way that is accessible for you.
Yeah. I like how you said that continual loop, because that communication goes all these different directions that all of you have touched on at this point. And I think that really ties into the previous question too, about how the federal changes around research infrastructure and funding have impacted us. Our policymakers need to understand the direct impacts and, short-term and long-term of those cuts to our community. And when we say our community, first and foremost, it's people with lived experience, right? It's people who are diagnosed with PSP, CBD, or MSA. It's care partners, family members, friends, but it's also our network of medical professionals who are caring for them. It's also our research scientists who are trying to understand why people get these diseases and figure out how to better diagnose, prevent, treat, and cure them. And policymakers won't understand what they're doing impacts us, and what we're doing impacts them, and all of that, unless we have that feedback loop as well. Being mindful of our time, and there's so many more questions I wish I could ask you all, but one other thing that I'd like to bring up, and someone kind of touched on this in the chat a little bit, is the coalition work that we're doing. So, you all know, and this is something we've talked about many times in other spaces with our advocacy work, is that it's really critical for our community, along with the Parkinson's community and the larger neurodegenerative disease community and other people's rare diseases, to unite in different ways in order to have a louder, more unified voice, so that we can make a real impact at every level and help policymakers understand why they need to prioritize these issues, how it's personal to everyone. But at the same time, it's really important for us to distinguish ourselves, PSP, CBD, and MSA, as their own unique challenges and needs and experiences, and so to find ways to advocate for our distinct needs as well. And I think coalition work really plays into that. So we're a member of the IMALS Cures Collective, which is really trying to fight for all neurodegenerative diseases, Michael J. Fox Foundation's Unified Parkinson's Advocacy Council, National Organization on Rare Diseases. We're exploring others. But Julie, or anyone else who'd like to speak to this, can you talk about what that looks like, and how we're trying to navigate that to have the greatest impact possible?
Yeah, I'm happy to take it. So I think one of the things that is becoming more and more apparent is that as Nisha alluded to, that there's the pie is getting smaller, and so I think it's really expected that sort of disease groups will almost like sort of fight against each other. And I think that no one wins when we do that. I think that there's a larger overarching importance of understanding the coalition work that Jessica's talking about. And that, especially in neurodegenerative diseases, it's very much interconnected in lots of different ways. And so, I think we've said before, like a rising tide raises all boats in neurodegenerative disease. A research breakthrough in Parkinson's is absolutely applicable to us because it means that people won't be misdiagnosed with Parkinson's, when they have PSP. And what would that mean if we could get people earlier in their disease journey? And so what I want to be really careful of is not falling into that trap, which I think is an intentional thing, to sort of pit groups against each other. It doesn't help anyone. It doesn't help patients. It doesn't help care partners. And I think that we're stronger together. So I think coalition work is absolutely a part of our advocacy strategy intentionally to make sure that we are aligned, and that our voices are stronger together rather than apart, with the understanding that we are separate diseases and we have some different presentations, different pathologies, all of that. But I think all of these diseases are awful, and we want to make sure that everyone gets treatment. And so part of not falling into that trap is that kind of coalition work. And I'm really passionate about, sort of, again, understanding that these are separate diseases with, different presentations or pathologies, or the same pathology, but different presentations, or vice versa. And, sort of giving that enough air. But in this current environment, I think that we're stronger together than, I think we're always stronger together regardless of the environment. But given this now, I really want to stress that, that coalition work is an integral part of what we do. And CurePSP has done incredible work in the past, I'd say 3 to 4 years in strengthening those relationships, and being a really active player in those coalitions. So I think that the organization deserves a lot of credit for that.
Being mindful of our time, we're a couple minutes over. I have a few closing remarks to do. Elizabeth or Nisha or Julie, any last minute thoughts that you want to impart?
I'll say something really quick. Change is inevitable. We'll just have to get a little comfortable with it. Our issues are bipartisan, bicameral. Keep that front and center. And whenever you engage in any type of these Hill meetings, we always say keep your politics at the door. There are a lot of folks who are interested and are willing to hear. We saw that with our appropriations meetings. We met with both sides of the aisle. None of them were contentious. And so no matter how much it might seem it's chaotic out there, sometimes just the one-on-one conversations with offices really go a long way. And so we're going to continue to beat that drum, but do want to leave you with, there is some level of positivity and people are willing to have conversations, just meeting them at a human level and making them recognize that these diseases are widespread and they impact people across country, not just in certain areas or a particular political ideology.
Thank you so much, Nisha, for kind of outlining that. I just wanted to add, we're changing our course a little bit. Obviously, kind of piggybacking off the MAHA movement was not something we were anticipating doing last year. That's not the angle that we were taking. But if there's, folks in the administration that are really interested in pursuing that, angle of healthcare, we want to fit in there. We want to make sure that PSP and all neurodegenerative disorders get into that framework. And so that's what we're trying to do. That's, a big goal that we have. That's why we're meeting with as many folks as we're meeting with. And then I guess just general advice for some Hill meetings is, I know these numbers come up, especially when we're talking about funding of, they're cutting this 100 million or this billion out of something. That can be very intangible to some folks, because we work with these large amounts all the time. But if you come up with, a very personal story about how this is impacting someone directly, your family member, someone in their community, a constituent that they represent, that's, in my opinion, just a really good angle to bring to them.
Well, I can't thank the three of you enough. This was, just the start of so many conversations and this growing partnership. And I'm just so grateful for having you all behind our efforts here at CurePSP. So thank you forever for that. Look forward to working with you more. And with that, I'll move us into our closing remarks. We had an email. If you all who are watching right now or watching this archived, if you're as part of our database and you get our emails, and I hope that you are, we had an email go out earlier today with a call to action to contact your representatives to ask them to co-sponsor the May Month of Awareness PSP resolution that Elizabeth had talked about. We had this go out recently on our social media as well. We're dropping a link to our toolkit in the chat so that you can contact your representatives and ask them to add their names to that resolution. Please make sure to follow us on social media and make sure that you are on our newsletter listserv so that you can keep receiving our advocacy updates. To be involved in efforts to be involved, including an announcement about the reintroduction of the Healthy Brains Act and how you can become an advocate around that as well. We are currently planning our virtual programs for the remainder of the year, and we will add those to our calendar at psp.org/events as soon as we are able, so be on the lookout for that. As a reminder, you can always check out the CurePSP YouTube channel for a ton of archived educational content from our past, including pretty recent webinars and family conferences. And lastly, it is always important to underscore that we are able to offer these webinars and all of our resources and programs, including our growing legislative and public policy advocacy initiatives here, because of your support of the CurePSP mission to raise awareness, build community, improve care, and find a cure for PSP, CBD, and MSA. So thank you all for your involvement and your support, and look forward to working with everyone in Congress and beyond in 2025. Have a great rest of your day.